Next up, we want to talk about what it actually means to be the CEO of your health. We've talked about customizing, tailoring the existing solutions, the application of AI, real-world data, all sorts of backgrounders by now. And let's talk about now what it means to be the CEO of your health, ways to empower patients to be the CEO of their health. And if I'm not mistaken, everyone should be ready by now. We have Aleksandro Grabulov, Head of Product at Fitbit Health Solutions Google, joining us today. Aleksandro, join us. We have Amin Esmaily-Fard, Senior Pharmacy Clinical Informatics Specialist, the University of Texas MD Anderson Cancer Center. And we have Larra Petersen, Lukenda, COO, CyncHealth Foundation. Larra, join us. Applause, please, ladies and gentlemen. Yeah, we probably need a bit more coffee today. Moderated by Matthew Foran, Senior Partner at EnableHealth. Matthew, welcome. And we should be having more than enough microphones, do we? Everyone has a mic?
I think so.
Enjoy.
Okay. Yeah, Larra said as we were coming on, it felt like a game show. So yeah, thank you for the music and the production. So yeah, I'm Matthew Foran, Senior Partner at EnableHealth. We're a global healthcare consultancy supporting companies navigate global healthcare ecosystems, namely Germany and the US, leveraging our network. And also leveraging cool conferences like this for added platform value. And I think if I was one of my clients sitting up here with these three panelists, I'd be in a very, very good place. So a lot has happened over the last 3, 4, 5 years as it relates to technology and research. There's a lot of information out there for patients to read. There's a lot of different ailments as well, and there's a lot to learn. So I think in terms of framing this conversation, it's important to note that while not everyone can be a provider, everybody can be a patient. And with those advances in technology and research, I'd kind of like to start at a little earlier in the patient journey. And Larra, this might be a great question for you to kick us off with, if that's okay. But what are the current services or tools that are available to patients to allow them to better understand their disease? And it'd be great to hear your background with Medicaid, with CyncHealth from the VA, and I know we had an interesting anecdote about diabetes in our first call as well. So entirely up to you how you want to take it, but that's just what spurred the question.
Sure. Well, thank you. My background is a bit varied and a winding path. I'm a psychologist clinically, worked in clinical areas for about the first third of my career, and then kind of made a shift over to program administration and development, and now doing a lot of outcomes research. I always say my example being when I was sitting in the transplant room doing evaluations for donors or patients, if I had a nickel for every time a patient said, but no one ever told me, I would probably not need to be sitting here, or I would be doing something a lot more fun when I travel. But what it really showed me early in my clinical career was a lot of the research and patient education approaches didn't work. Patients were not absorbing the information. And there's a lot of reasons for that, but I think that all of the reasons lend to more effective approaches with today's technology. Historically and still today, the kind of tried and true methods for patient education and counseling involve using multimedia methods. So we're all different types of learners, and your age and the time and where you went to school seem to predict that type of learning. So using written, visual materials, conversations, as well as teach back kind of is one of those approaches where it's really less about telling and more about asking so that you can assess the relevance and impact of the information.
Great, and maybe Sandra, a great segue into understanding what Google Health and particularly the division of Fitbit as well, what they're doing to help patients better understand their metrics. Like how are we getting meaning from the metrics? So yeah, I'll leave it there because I could talk on that for a while as well.
Yeah, thank you. I mean, the adoption of wearables is obviously everywhere. Even if you look around here, you will see how many of us do wear devices like that. But I think the real breakthrough that is happening is the adoption of medically regulated sensors within the wearable. Think about heart health, AFib notifications, think about some other angles that you can have now with diabetes, etc. So having now in front of you a set of data that go from sleep, activities, your stress levels, your heart health, you suddenly started getting a very comprehensive set of health matrices. The problem is putting all of that in context is, I think, one of the biggest point that most of the companies are trying to do now. So I think the real personalization of your health comes from ability to actually modify your daily habits and recommendation based on the dynamic set of data and context between that. And later on, we will be touching a little bit more on that, what we are doing, for example, with an AI angle on top of it and trying to understand your behavior and your data overnight when you wake up in the morning and have your daily readiness score, for example, proposed to you. So I think people do have an access to a lot of data. I think they have a challenges making the meaningful, actionable steps out of it, and I think that is where we come in with some solutions.
Yeah, thinking of a lot of questions for later on as to how we can take that forward. Amin, within the healthcare settings, so Sandro's speaking about all these different medically regulated devices as well, but as a clinical pharmacist and technologist within digital healthcare, how do you suggest or how do you navigate that intersection of the intersection of the human touch and then the digital touch from that provider perspective?
Yeah, so that's a really great question. So both are needed. I think the best approach is always a hybrid approach. I think with the advent of a shortage in healthcare providers, primarily in primary care, we're seeing now the greater need for technology, things like telehealth, apps that help patients, inform patients of their disease states and things like that, and also give them access to different types of healthcare providers. So that's going to be ever more important and play a bigger role in healthcare. But also, you're always going to sort of need that physical touch, that consultation with a provider, to better be able to understand, for me as a patient uniquely, what do I need to do for my disease state? It's great that I heard a lot of pitches this morning and a lot of these apps that are coming out, they're really promising, but it's still very broad. You're managing a disease state very broadly, which is good because a patient can understand from a general standpoint, like if I have diabetes, what does that even mean? What are some of the biomarkers that I need to be worried about? But being able to go into a clinician's office or virtually through telehealth and consulting them about, okay, what do I personally need to do? Because I'm not only dealing with diabetes, maybe I'm dealing with high blood pressure, maybe I'm dealing with obesity, maybe I'm dealing with mental health. And then don't even get me started about the economic and social determinants that patients are dealing with. So I still think that there needs to be that sort of one-on-one consultation with a provider. But yeah, digital health is going to play a huge role when it comes to data analytics, giving patients access to, as Fitbit does, their heart rate, their respiratory rate, maybe being able to detect abnormalities in heart rhythm, but then being able to then go and talk to someone about, like, okay, what does that actually mean for me?
Yeah, and Larra, what's been your experience in terms of working with individuals when you were in these primary care centers as well, in terms of helping them adapt to these new technologies to understand? So the actual, I've never had to use any type of technology to monitor my health. How can we better prepare patients for that? Yeah.
Yeah, so I had just finished my fellowship at Mayo in 2009 when they were kind of starting their original app for helping patients with different types of behavior changes. And I think as their journey and many others have kind of come to fruition today, it's really about really assessing relevance and reasonableness. And I know we've all commented on that in some capacity, but I think what apps have the potential to do is really synthesize a lot of information, and then using some information that's provided by patients, it's then helping them translate that to their own patient journey. And I think getting patients to adopt any kind of technology is really about how useful it is to them. Today, in a lot of our different types of surveys or looking at other types of research, you see patients don't really find the technologies all that helpful. And so a lot of that does come down to, as mentioned, it's not about general stuff. 80% of patients have already gone to Google or other methods to determine what they want out of their healthcare. So if we can't make it more customized than that, I'm not really sure patients will find it of value. And I would say that's been consistent.
Yeah, and then so I think between your response and Amin's response as well, so within that global technology landscape in healthcare, we seem to have these silos. So a behavioral app, we have a fitness app, we have a diabetes app. So maybe back to Sandra to tease some of the stuff that might be coming out of Google Health. What is the best way that we can actually start to move more horizontally across these? And to Amin's point, you know, the app itself starting to, or the platform and technology starting to recognize, well, this person does have diabetes, but it still wants to act as a lifestyle app or a lifestyle coach, but factoring these other ailments in as well.
Yeah, so indeed, I think we all agree that it is an end-to-end experience that matters. It's absolutely broken. And it is complementary. So I think the digital and obviously a clinician touch needs to come together. We believe that steps that we make initially should be just difficult enough for a patient to actually adapt it. So let me give you one example. We have launched the AFib notification, so irregular heart rhythm notification, resting heart rates, all of that are being monitored, even the ECG feature. So we have cases where consumers get an AFib notification for the very first time. They don't even know that they actually had an underlying potentially condition. Now, in most of the cases, that stays there as information unless you make it actionable. So what we are trying to do right now is to have a single set of seamless steps where you can immediately connect with your clinician, doctor, cardiologist directly, through your health insurance, for example, which reduces the barrier to entry. So you see now the payer starts getting into the ecosystem to enabling that connection, and you shorten the timelines of getting to the actual care. So if we would know information about your health insurance, if you have got it as a part of your health plan, for example, in the US, device itself, suddenly you're part of that ecosystem. So what we are doing is creating that link of you have received an insight about your health, which can be a direct, like this notification, or can be contextual, based on multiple factors together. We are not diagnostic, anything. We don't do that. That's not our job. But our job is to show you a trend and immediately, through the channels of payers or providers, connect you with that care. Yeah. And I think that's the first step. Underlying fundamentals are still challenging, and that is data transfers, interoperability, EHR integrations. I will not even go there. Million challenges to be solved. But I think that is where we see that step from preventive care to potentially early diagnostics and linking you directly to a provider. I think that's the first step that is missing and potentially can provide end-to-end solution.
Yeah, and we are seeing a lot more chief data interoperability roles come up in organizations as well, which I think is, we're already seeing that happen at the moment. So now I'm the patient, I have the most advanced Google Health technology, I'm online, And this happened last week. I received a pitch deck that quoted ChatGPT as the source. How, and anyone feel free to jump in on this one, but how can we support patients navigate maybe disinformation or, yeah, I'll start with disinformation. We'll shift to mistrust a little later. So who wants to kick that one off?
Well, I can speak to that a little bit. So I think that's one of the biggest challenges moving forward with healthcare right now, is if you go on Instagram, everyone's a physician now. Something new comes out about microplastics in our food or, things contributing to cancer and what have you. And then that gets taken to your provider and saying, hey, look, this medication or this diet or this lifestyle is contributing to me potentially getting cancer one day. And a lot of this is not grounded in scientific research. So in the United States, healthcare visits, recurring healthcare visits with your primary care are limited to 15 minutes. So your doctor only has 15 minutes to see you. So imagine half of that or that entire time, you as a physician, you're now talking to that patient about what they saw on Instagram or TikTok, and you have almost no time to talk to them about, hey, how's your lifestyle modification going? Have you been, coherent with your medications? How have you been feeling? And all of this. So it's really becoming a massive challenge for providers to navigate. And I personally don't know the best way to solve that, but it is something that we definitely need to be concerned about.
Yep, Sandro.
I can add one thing. Even without knowing, when I came to Google and stuff, I was very interested about YouTube business. And our YouTube business has a YouTube Health division, which aims to do only one thing, and they're doing a pretty good job, and that is authoritative healthcare content, which is approved by, backed by science, approved by various agencies, and it has that stamp that says if you watch this video, and we use it, for example, we try to develop a lot of preventive health programs with health plans, and let's say you need to do your colonoscopy for the first time ever. There are small videos that describe what it is, why it matters, even walk you through entire journey so you know what to expect when you actually go into clinics. And that content is being stamp approved so that you don't need to worry about the validity of information and stuff. So I do feel that we have responsibility also having the mass reach as we have to actually create those type of contents that are valuable to people, and by the way, free. It's not something that we would ever put in a context of a business model. It's really all about getting the right level of information. So I think it's an early first phase of tackling that challenge, but I think something that I personally find out very important when we are embedding content like that.
Yeah, and Larra, with the work at CyncHealth as well, maybe you're able to touch on how you're supporting different research outlets as well with different outcome data for patients, and how that can be more, one, amazing research has been completed. How do we get it out there? It's transformational. And two, how do we disseminate it? How do we work with Sandro and his team and get connected with YouTube Health to ensure that it reaches not just the academic and clinical audience, but also in a way that the patient audience can understand it as well?
Yeah, absolutely. I think if we think about translational research, it's really thinking from a multidisciplinary approach. I can say in my career, I've been very narrowly focused on certain outcomes, and I work within the people that I know or that are treating it, and I don't look outside to other disciplines to help inform a better overall study. And I think if we're looking at T4 studies, I think it's really understanding that multidisciplinary approach. I think the more important question that you asked is, how do we translate research? And I think that is really, if we can solve that problem, we're probably going to see improved adherence as well as a lot of other opportunities in patients. Again, I'll go back to if we really understand and can like boil down all the complicated concepts of research and understand the relevance and pitch that to other disciplines as well as patients, I think we'll see a lot more uptake of really advisable research as opposed to the Instagram posts on gut health and what you should take. I also think that then it's really a lot around creating a forum for asking questions. Even in very good, well-controlled clinical research, that is a very circumscribed piece of the puzzle for a lot of our patients and not including a lot of the other complexities that patients have.
Yeah, I guess, sorry, just a quick follow on to that then as well. How can we engage the patient or the patient within the study or the clinical trial a little bit more qualitatively? I think that's a word. Just to kind of get those more qualitative outcome measures and introduce that into the critical thinking.
Yeah, so I think your question about what is CyncHealth playing a role, I do think that it is understanding the value of both quantitative research through clinical data, using data lakes now is incredibly popular, but not missing out on the impact of, old-fashioned qualitative research and understanding focus groups. If you ask, people will tell. And I think when they can explain and correlate and see their own data related to their different types of behavior impacts, that's when we'll see the patient engage and change. Otherwise, again, it is more information that isn't highly valuable to patients. So helping them see that correlation and asking for that feedback will improve our care significantly.
Yeah. Amazing. I jumped a little ahead of my script in my head, but just coming back a little bit to the mistrust portion of the data. So what we're seeing is true, the information is there. I have a patient, as a patient, have found it. However, I'm thinking, is it true? How do I double check it? Again, I think it does come back to that blend of the personal touch and the digital touch. Maybe that needs to be a little bit more dynamic on that scale, but how have you seen that work in the healthcare setting? And then following on, Sandro, how are you trying to combat it within the new updates and all the other technological things happening at Google Health?
So I think like you were mentioning, the best way to approach it is a hybrid model. Again, Larra mentioned this about being, shifting from that very direct, this is what you're supposed to do as a physician talking to a patient, just spewing out knowledge and information about their disease state and not allowing them time to ask the questions that are relevant to them or evaluating their life circumstances that may prohibit them from being successful in implementing that treatment plan. I think that's the most important thing is we've got to make that shift. There's a technique that Larra is probably familiar with called motivational interviewing that's gotten a lot of study and a lot of research that really prompts the patient and sees the patient as the change agent. Like they are the ones that are going to make the change, and it's you as the provider that you provide that underlying background information about their disease state, kind of the options that they have available. But then you ask them, you prompt them questions to see, okay, what are the obstacles that you face as you, the unique patient that you are, with the life circumstances that you have, that are going to prohibit you from being successful in this treatment plan? And what are the things that you can, and the resources that you can tap into that are going to make you successful and that are going to reinforce the behaviors that you need to engage in to be successful in your health? So I think it's again, making that transition from just spewing out information and knowledge to, again, being more of a dynamic discussion and really seeing that patient as the person who's going to make the change. Yep.
Yeah, so I think continuation of that is really what I like, that the most of the things do happen in between visits. You have that visit of 15 minutes and then maybe in a few months. Let's take a chronic condition patient that might be going more frequently. What we are trying to do is to create that preventive plan as personalized as possible, knowing the motivational factors, knowing the goals, but also limitations. We are all pretty different. I like one thing to do, I hate some other things to do, and I know they're important for me, but I can't do that properly, etc., like fixing or hacking my sleep, for example. But talking about that, we have created a way where we believe, and we have shown that there is a power of understanding what works and what doesn't work for you as an individual, and bring that into conversations with your clinician. So for example, for heart health patients, we have seen the quality of conversations dramatically improving when they actually bring that ECG PDF report, not because we want to replicate the ECG that will be done, no, but because it provides the context of how your life habits and the things that are overlapping the data that you've seen can give your doctor, for example, ability to have much more targeted conversation and actually show you, because seeing is believing, and then hearing it again from your doctor, and that's that hybrid model reinforces something. And I think that is where we see the biggest opportunity for behavior change and the lifestyle changes. When you see the trends, those insights get surfaced to you, and then you bring that in a very seamless way, because no one has time to analyze it, with a conversation with your provider. And that is the powerful, I think, link.
Yeah. Oh, go ahead.
I was just going to add to that. I think that's a wonderful way to describe the very paternalistic approach we've had to healthcare historically, with the potential of innovation and technology going forward. One of the other opportunities, I think, using that time in between visits is a patient comes in more prepared to have the conversation. In a 15-minute visit, which is actually like 8 minutes, I think now, of when you might actually get to have the conversation with your provider. Unfortunately, the amount of time that patients have to describe what's happening with them or their questions is so limited that they're getting additional information out of context. And so they are not ready to ask good questions. They are not ready to process the information. Those neural pathways are not open to, thinking critically and making decisions. And yet all too often we ask for decisions in that same visit. So I think having them come in really ready and prepared, and then going to the motivational factors where they can think about their own lifestyle, only really enhances the visit.
Yeah, no, that's a very good point. That foundational level of education going into the appointment rises. With the trend, you're able to see where you were, where you are, and if those habits don't change, where you're going. And I think that's really interesting. But of course, we can't put all the pressure on the patient to be their own CEOs. CEOs are surrounded by a team, and they're updated. So I guess with AI, artificial intelligence, being the buzzword in healthcare at the moment, but the potential of that to support a lot of administrative tasks during appointments frees up a bit of time. So assuming within the 15 minutes we actually have space for 3 more minutes, how best should the clinician or practitioner use those 3 minutes to further empower the patient to make those habit changes? Let's say they've come in with their Google Health. We know what's happening. We know what habit changes have to occur. How can we empower them further? I don't know, Amin or Larra, probably a question for you.
So yeah, I mean, those 3 minutes go by quick.
Yeah.
Having been in the clinic, I think the biggest thing is continuing to empower patients to, especially if they're coming in with this information, that, hey, you're doing a really great job. Continue to take ownership of your health. But again, I go back to really evaluating the factors in their life that are going to prohibit them from, continuing on in that, in that sense and being successful. Ambivalence is a huge thing. As Sandro had mentioned, like, we all have limitations, things that we're really good at and things that we're not so good at. So it's really evaluating those things for that unique patient, so that, they're not having to come back every week, if they can get an appointment, just because they're going into, they're relapsing or what have you, or they're not being compliant. So, if we can evaluate those factors, and especially for larger healthcare systems, We can get them in touch with a caseworker, a patient advocate, to give them the resources they need to handle their life situation so that they have more time and more resources to dedicate to their health. They're just going to be that much more successful. So I don't think it's ever, there are a few patients where education is an issue, and I think that's where the apps and Google and things like that come into play. And patient education sheets that providers can hand over to their patients to read whenever they go home. But it's really just evaluating their life factors that say, hey, what's going on that you're not able to dedicate time to your health? And you'd be surprised by the answers. Like, some people can't afford a car to go to the pharmacy to pick up their medication, or they can't find somebody to drop them off to their physician appointments or what have you. So it's really interesting when you start evaluating those factors, what answers you get.
Yeah. Larra?
Yeah, I was just going to say, I think you mentioned AI. If I had my druthers, if I could have something in clinic to really help. One of the things that I have found in my own clinical experience, and I think research is supporting as new patient education or counseling approaches, is, augmented reality. So you mentioned the then, now, future. If patients can actually visualize what their choices have made for them, and then changing their choices. And as I'll say in my own career, knowing when it's too late to make the choices. Because sometimes, unfortunately, they get the ability to make choices, but no matter what they do, it's too late to turn their health around. And I think providing that earlier and helping them visualize what choice could I make today and the impact on this in 1 year, 5 years, allows patients to be more informed.
Yeah, and I think to what Sandro had mentioned earlier, if we can reduce the burden of choice, if we can point them in the right direction, I've labeled it Netflix syndrome. Like, what do I watch now? Like, there's so much information out there at the moment. But Sandro, out there at the moment across the technology landscape, what innovations, whether internally at Google Health or externally, are exciting you the most as it relates to patients and patient health?
I mean, there's, a lot of stuff that are exciting. And I think, but I would start with something very simple, just to build on our conversation here. You mentioned the word getting that burden of decisions, understanding something early enough. So I think the first step, and that's something that we are already embedding in our product, is the use of generative AI in your personalized daily plan. So let's use a very realistic example. Let's imagine you are a chronic condition patient. Let's say you have maybe diabetes. You have your preferences and limitations already placed in a product. Even today, based on the data that we collect during your sleep, so when you wake up in the morning, you feel potentially tired, you are, my favorite topic, as I mentioned, sleep. So you're tired, you know that you need to exercise. You know, by the way, your link between what happens with your glucose levels when you walk for 20 minutes after lunch or where you don't walk. But let's imagine you wake up in the morning and your readiness score is very low. You're not feeling it. You're not going to hit the gym. You're not going to do any type of activity. Usually our recommendation engines in the past would have a pre-designed program for you, try to motivate you and hint you to do one thing or another. Where the generative AI comes in a story is understanding the context of data. So currently we are able to understand the context of data better. You are able to actually talk with the device, basically ask few questions and get dynamically modified program for that day. So think about the fact that I can realize that you are not in your best prime spot today and change that 20 minutes workout to be something that is easily accomplishable for you and will do a good when it comes to your state that you are. Or take a person who might not have chronic conditions, but is just doing preventive care with a healthy lifestyle. We have an example of someone who said, my 5 miles run felt much harder today, and asked the generative AI that is embedded in a Fitbit app. And what the correlation engine basically found and just gave you as a star diagram is that your heart rate links together with your quality of sleep, not the duration of sleep. Oh, I slept 8 hours. No, your quality of sleep was very poor. And it compared it back with the other 5 miles runs, basically found exactly the reason why you felt like you should. And from now on is modifying your daily setup, because motivation is important. The worst thing that can happen is to push someone to do something that they're unable to accomplish in that day. So it's relatively simple case of using AI technology, but we found out to be extraordinarily beneficial in the daily life. So those early phases of adoption is what I'm the most excited about.
Yeah, and if we had another 30 minutes, I'd question you a lot on the different external environmental factors and tapping into your Nest thermostat to make sure that even your sleep temperature is on point. So, but just as we look to wrap up the panel in the next couple of minutes, and kind of thinking about everything that we've said, I want to ask each of you one question, and that is, what does it now mean, after what we've learned, what does it mean to be the CEO of your own health? Amin, you're the first person on my left.
Sure.
And 30 seconds left.
Yeah. So taking ownership of your life. So we've all been dealt genetic playing cards, and so predisposed to diseases or already have diseases. So even despite that, it's taking ownership and realizing, hey, it's me that now has to deal with whatever it is genetically or whatever environmentally to ensure that I have the optimal health that I can possibly have.
Sandro, 10 seconds.
So I would just build on that and say basically, help me understand the context about my data in 10 seconds when I wake up, and give me the simplest next best health action for that day.
Perfect. Larra, 8 seconds.
Okay. I would say it, much like any CEO, it's understanding what is the vision and the strategy, and then choosing a qualified team, and then acting on the decisions because you committed to them, even when it's hard.
Thank you. Ladies and gentlemen, our panelists.
Thank you.
Now, Matthew, stay with us. We promise that after each and every panel, you will have an opportunity to ask a question or two. We have like 2-3 minutes maybe before the next one. Do you have a question for our panelists? Now that you've seen how liberal they are with the notion of a second. Anyone? Please feel free to ask questions. Yeah, you've got one. No? It was just an accidental bad timing when you raised your hand.
I will ask one thing. Do you think, what's the difference to be the CEO of your health or the leader of your health? Do you think there is a better word, one from other?
That's a nice, quick improvisation, I have to admit.
I'll take a stab. I think people would perceive patients could perceive CEO as a level maybe not attainable to them, so maybe leader is more translatable. I think regardless of whatever word we might choose, it's about ensuring that they feel empowered and moving away from that very paternalistic approach, and then knowing what do they want to know. Ask before tell.
Yeah, and I just add that within the C-suite level, there's a team around the CEO. Sometimes I can see a leader as just being it can be one individual by themselves. So where it relates to CEO, I think, but yeah, I guess it's mainly around the empowerment. Yeah.
Anyone else? Yeah.
Yeah, thank you. Hi, I'm Sophie. Thank you very much for sharing. So you've spoken a lot about the importance of having more informed decisions, data-driven context, but I wanted to hear a little bit more on this idea that how do we make or enable people to act on the information and your experiences with that? So not just providing more information or smarter information, but what do we need to do to change the behavior in relation to that information and your experiences? Thank you.
It comes a little bit to my last visionary point, and that is you need to make it very actionable. I mean, I also can feel tired when I wake up, and I can maybe see the data that will show me that my sleep did not have a high quality. but what do I do with that? So I think the element of recommendations that are coming based on very contextual and dynamically changing parameters, and it's not a simple rule engine that is being predefined during the development. No, it has to be a very dynamic engine, and that is where LLM models actually played a big role. They create a context, they create a logic, and they change it afterwards. So I think being able to have an actionable insight on a daily basis that can make you that next step is the key. And we see that happening, not only in Google, in other places as well. And people do respond to that.
Larra, Aleksandro, Amin, Matthew, thank you very much again.
Thank you very much.
Thank you.